Bariatric surgery is considered to be the most effective, durable tool we have against obesity. It's not perfect, but it is the best tool that we have today. Obesity is a chronic disease for which there is no cure. And when you have an operation, the surgery goes with you wherever you go. And so it is a tool always there to help you stay healthy. Most patients have an improved quality of life after surgery. Of course, the motivation for their operations may be different, but the end result is that their quality of life is better. Whether that's related to diabetes, blood pressure, sleep apnea, joint pain. Overall, our patients are not only healthier, but happier after surgery. They're still able to enjoy foods, they're still able to enjoy time with their friends, but they're able to live their lives better after surgery. Patients pursue surgery for a variety of reasons. Sometimes it's as simple as they're tired of being heavy. However, our patients have tried multiple diets over many, many years, and their motivations often run very deep. Sometimes our patients come to us because they want to get rid of their diabetes or their sleep apnea. Other patients are struggling with infertility related to their obesity and desire to get pregnant. Other patients want to be able to get on the ground and play with their grandkids and get back up. Some patients want to travel and can't get onto an airplane at their current weight and so seek weight loss surgery so they can go to Europe. We see many motivations. Some of them are health related, some of them are quality of life related. Nonetheless, we help patients who are trying to lose weight in the most effective way possible. The amount of weight lost after surgery is highly dependent upon the individual and the surgery that they had, not to mention important eating habits after surgery. Our sleeve gastrectomy patients will lose 60% of their extra weight, our bypass patients about 75% of their extra weight, and our duodenal switch patients about 90% of their excess weight. We've seen people lose upwards of 300 pounds after surgery, and so the total weight loss really depends on the individual, good compliance with favorable dietary habits after surgery, and the type of operation that they had. Most patients after surgery have no limits on the types of foods they can enjoy. We certainly counsel people to avoid high carbohydrate foods. However, sleeve gastrectomy patients can eat almost any type of food that they like. If gastric bypass patients have any limitations, it's usually related to the bready or spongy doughy foods like bread, rice, or pasta. And then our duodenal switch patients can also, much like our sleeve patients, eat what they want with the exception of fatty foods. Excessively fatty foods may make patients have some diarrhea or excessive flatulence. There are effectively 3 weight loss procedures that are done today: sleeve gastrectomy, gastric bypass, and biliopancreatic diversion with duodenal switch. As you go from sleeve to bypass and bypass to switch, you tend to get more weight loss and more durable weight loss and more effective treatments of the health problems that come with obesity. Sleeve patients can expect on average to lose 60% of their excess weight, bypasses 75% of their excess weight, and duodenal switch upwards of 90% of their excess weight. Interestingly enough, in bariatric surgery, it's one of the few fields in medicine where patients often determine their care. Assuming there's no reason why a patient can't have a certain operation, our patients often choose which operation is right for them, of course, after counseling with us, and we discuss with the dietitian what operation might be best suited for them and their overall health and weight loss goals. We see dramatic improvements to patients' health and their weight after surgery. Interestingly enough, oftentimes we see diabetes go away within a few days of surgery. Sometimes people's diabetes is gone before they even leave the hospital. Weight loss happens over time, and the more aggressive procedures tend to give faster weight loss. But over time, we see that diabetes improves, blood pressure improves, sleep apnea often goes away, joint disease improves, cholesterol panels improve. These changes happen over time. They certainly don't happen overnight, but the pace at which they improve surprises even me at times. Our patients can expect to see 60 to 70% improvement in their diabetes, and about 80% of our patients will have a complete cure of their diabetes, depending on which treatment they had. Because we use minimally invasive techniques for our patients recover from surgery very quickly. Most patients typically spend 1 night in the hospital, rarely more than that. By 4 or 5 days, our patients are essentially pain-free for the most part. Oftentimes, our patients don't even need narcotic pain medications. In fact, only about 15% of our patients ever need narcotics after surgery. Bariatric surgery is not a magic bullet for obesity. Sometimes we like to think that because we're doing an operation, the treatment is over. However, obesity is a chronic, lifelong disease for which there is no cure. Food is a part of our daily life. Food is a part of our social lives. We don't do anything with our friends or family that doesn't involve food. And so we may do an operation, but lifelong follow-up, not just with the surgeon, but with the entire team of dietitians, psychologists, is important to make sure that people are staying on track. This is not a cure for obesity. This is just the most effective treatment in medicine that we have today. Bariatric surgery has never been safer. In fact, a recent study showed that having bariatric surgery is safer than having your gallbladder out. And the reason for that is our patients who come to us for bariatric surgery come to us electively. This is not an emergency. Our patients are not in the emergency room. And so we have time to make sure their heart, their lungs are optimized before surgery, and that they're healthy enough to undergo surgery. It used to be that when we were doing these operations open and have to open their belly completely to do the operation, the risks were higher, complications were higher, and mortality was real. However, in modern day medicine, the risk of dying from surgery is less than 1 in 3,000. When seeking a bariatric surgeon, it's important to understand that different surgeons have different training. Finding someone who's experienced in minimally invasive techniques, who is fellowship trained, who is board certified is very important. I think finding someone who's had experience is very important, and someone who's able to offer a wide variety of operations. If a given surgeon only offers one operation predominantly, there aren't other opportunities for a patient to get other operations that may be better suited to that patient. So finding a surgeon who's capable of doing the whole range of operations, including revisions, specializes in minimally invasive techniques is extremely important. Robotics is the next wave in bariatric surgery. Robotics has taken over the field of general surgery and continues to help our patients to recover faster and have better operations. Within bariatrics, there are a lot of nuances to the techniques. Sometimes intestines need to be rearranged, other times we connect one piece of intestine to another. The robotic platform allows more precise surgery to help decrease the possibility of complications after surgery and improve recovery. We've adopted a robotic platform for this reason, so that our patients overall do better and feel better and recover quicker. We are often asked about age cutoffs for bariatric surgery. There's no firm age cutoff. In fact, after people become age 40, 45 years of age, we tend to see divergence in people's health. And so I've operated on people as old as 84 years old. It really depends on their overall state of health. And so we've operated as young as 19 years old and as old as 84. The firm number doesn't matter. It's how healthy that patient is and whether they'll be able to tolerate an operation. Extra skin after weight loss by any means is a real problem for some patients. When people lose upwards of 100, 200, or even 300 pounds, extra skin can hang down, cause discomfort, rashes, skin irritation. And so oftentimes in those patients, they may need the skin taken off. Overall, we know that about 3% of patients who have bariatric surgery end up getting plastic surgery down the road to get that skin removed. Our patients most certainly can get pregnant after bariatric surgery. In fact, there are patients that come to us that help get pregnant because their obesity currently stands in the way of their fertility in the form of PCOS or other causes. So we encourage our patients who wish to get pregnant to wait 6 months after they've stopped losing weight. For our sleeve gastrectomy patients, typically that's about 18 months. Our bypass patients about 2 years, and our switch patients about 2.5 years. If our patients get pregnant after surgery, we want to make sure that their vitamin levels are appropriate throughout the pregnancy. In fact, the literature says that people who have bariatric surgery before getting pregnant have healthier babies and better pregnancies. If you are thinking about having bariatric surgery, it's important to find a program that is multidisciplinary, comprehensive, and has experienced surgeons that are here to help you with a wide variety of different operations that may suit you best. Please give us a call, 469-620-0222. Thank you very much and have a great day.